Welcome back to another episode of Beyond the Practice. Today we have a distinguished guest joining us, Dr. Orvil Martinez. Dr. Martinez is a seasoned professional in both the healthcare and hospitality industries. He's passionate about improving healthcare outcomes and promoting best practices in hospital administration, always striving to create systems and programs that positively impact customer service. Beyond his professional work, Dr. Martinez is also an accomplished author, public speaker, and entrepreneur. Thrilled to have him on the show, and I'm looking to hear his insights today. So welcome, Dr. Martinez.
Thank you. Thank you for the invitation.
No problem at all. So before we get into the actual questions, I do want to turn the floor over to you because we kind of connected last time, and I want people to hear a little bit of the background story, what you're about, where you've come from, and everything like that.
So I'm a primary care. I have been quite a while working as a primary care here in San Juan, Puerto Rico, and for around maybe more than 18 years. And since then, I have been also working as a researcher, maybe for 17 years. And plus, I have my wellness practice, I have my private practice, I have the research practice. Plus, the research has another division where we do consult with clients on AI and healthcare.
Busy man you are. So given your extensive experience in clinical research, what are some of the most significant advancements you've witnessed in drug development and vaccination studies over the past decade?
Well, let me take point from AI use since the vaccine. I mean, the COVID vaccine. It's totally different right now because we have seen a lot of speed on drug development, so which is really good. Just taking into consideration that example, I mean, the COVID vaccine was done maybe in less than 1 year using AI. So now drug development has been speeding, so we can have more treatments on I mean for trials even before maybe 10 years ago.
Yeah, no, absolutely. Like you said, the COVID vaccine within a year, that's way faster than it used to be. Absolutely.
Exactly, but that's the reason, because sometimes if you don't explain to people what happened there, it's a lot of there was a lot of work and development, but AI was great on same on that spot.
Beautiful. So Advanced Medical Research Center focuses on diseases like, diabetes, hypertension, HIV, hepatitis C. What are the current frontiers in research for these conditions, and what breakthroughs do you anticipate in the near future?
Well, I think that what we have seen in the past decade is enrollment, because we can have we can have the drug development and everything that goes around that IP drug that we call. But if we don't have the patients, well, we get short on trial. So in the past decades, I have seen less patients going through clinical trials. That's something that maybe in the next 5 to 10 years could be lowered, maybe with the use of AI, because now we are using a lot of tools like precision medicine.
Gotcha. Yeah. AI is just advancing the game everywhere, as you and I both know.
Yeah, yeah.
So when we look at the process of clinical research, how does this process ensure patient safety and ethical considerations, especially when dealing with, new drugs and experimental treatments? And I'm super excited to hear about this because I'm very interested in this.
Yeah, yeah. I know safety of the patient is first. We as a researcher, we have to always look on the wellness of the patient. So and another point is that once if we have a IP drug, a drug on development, we have to check. I mean, we have to see that this medication could saves a life. Okay, so taking from there, uh, Yeah, the clinical trials in the next 5 years could save a lot of lives.
Yeah, absolutely. And now, like patient recruitment, right? It's a critical aspect of clinical studies. Can you just elaborate maybe on the strategies like that your center employs, particularly through health education to engage and recruit patients like effectively? So, what does that like recruitment look like for you?
Well, patient recruitment here in Puerto Rico is totally different from the States.
Okay,
In the States, you have a lot of social media involvement. Here in Puerto Rico, because we have a small culture, and social media doesn't work as there. So what we have to do is to see, if I bring a drug here for trial, I have to see first why I'm bringing the drug to my clinic,
gotcha,
because the first reason is that I have one, two, or three patients that can benefit from it. So in that part of recruitment, I can take my patients into this trial.
gotcha,
And after using it, something that you asked before is that the safety, it has to be also, a consent. I have to consent the patient. I have to explain the patient, this is what could happen, but we have to measure the risk and the benefits.
gotcha. So it's not, let's just bring this here for clinical
Oh
trials
no,
without knowing. It's we're
oh,
going to
no, no, no,
know it
never,
first. We're
never.
going to know, kind
It
of clients. Gotcha,
it requires a lot of we have to be very ethical, and it requires a lot of regulation by the pharmaceutical industry and all the people that is working around, all the organizations that are working around it. For example, the IRB. The IRB is that organization that they approve what the pharmacy wants to do on a trial. So you have to be ethical. We have to consent the patients. We have to inform the patients, and we have to report any minimal side effect, or we don't want to see any adverse effect on these patients.
so now transition to your role at Medical Artificial Intelligence Solutions, right? How is AI currently transforming clinical research from data analysis to identifying potential study participants?
Wow, it's amazing. I haven't touched it yet, the
Yeah,
use of AI, but I know that it's improving the way that you can recruit patients. There are some companies right now that they have built a website where, if some medication comes to the market, I mean a pre-market that we are in a trial, the algorithm is searching for those clinic and patients that can benefit from that medication, and that is, we can see it. I have seen it on precision medicine, that we take blood samples to this patient that has any, for example, a cancer condition, and once the report comes back, it comes with the all the medication that the patient can use, or where, if there is no medication, where is a clinical trial in the US and the world. So imagine.
phenomenal, right? Like
Oh yeah.
just absolutely ridiculous. That's why I love it. I really do. I love the technology. So now talking about, I guess, clinical trials, I want to move into like challenges in bringing a new drug from the research phase, to the market. Is that something that your company has experience with? And if so, how does your center navigate these complexities, from that transition from phase to market?
Well, the, from my hands of what I can do with on clinical trials, it depends, because once we have an IP drug in the center, I mean, we have to follow all the rules by the IRB and the pharmaceutical. So it takes time. Maybe, for example, in my case, most of my trials, they are phase two and phase three. But you
Gotcha.
know that it can take 10 years, at least 10 years, from phase 1 to phase 4 and market. So it depends the urgency of the medication that can make it go to the market before that time. So, and I add that AI is trying, that's what it's trying to do, trying to short the phases of clinical trial. But I take an example that I had on COVID trial during the COVID time. When I was here working with a pharmaceutical trying to get the Paxlovid medication, we worked almost 20 hours per day trying to short the phase so we can have the medication in less than 3 months. So that is something that it doesn't happen very often, but a situation like that can short the phase of the clinical trials.
If the urgency is there and the envelope is pushed, it's gonna try to shorten those
Exactly.
clinical trials, right?
Government is behind, pushing this because it has to be approved by the
Yes.
government and the
Yeah.
FDA.
Gotcha. Okay. So, as a medical correspondent, so how do you bridge the gap between complex medical research and then like public understanding, just to ensure that accurate and accessible information to the public? Because I'm not one that's really too familiar with the clinical and complex medical research. I dabble in it here and there, and I know just from my profession. But if you talk to, let's just say, a regular Joe or even my father, how do you bridge that gap between the public understanding and clinical research?
Oh, well, that's a really good question. I don't know how to answer actually that question. Like, you want to, I mean, your question goes like how to teach people, if I'm not
Essentially.
wrong.
Yeah, yeah. No, essentially, if because some people could have, I guess they could be, skeptical of clinical research, and then
I know. It's very hard. Yeah, it's a very hard one.
even
It
like
takes time. It takes a lot of time, and I can say from my experience, because I can talk about my experience. Um, that is totally different from any other center. But you have to build trust with the patients. If you have trust and purpose, like I said before, you build trust with them, you educate them, you consent them, you are trying to bring something good for them, because there is nothing in the market close to it.
Mhm.
You see,
Yep.
right now we're working with medication to lower cholesterol on patient that previously had a myocardial or CVA, so infarcts. But there is no medication in the market close to that. And if there is one that is close, they cost $1,000. Thousand. I can tell you that 1 year can cost 17,000. So, and they are not covered by the insurance. So I'm bringing a solution to my patients, but they have to trust me, and I have to educate them because it's my responsibility. The benefits and what could be wrong. See.
So I know when I first asked you that, you said you don't know how to answer it, but I'm gonna tell you, I think that was the perfect way to answer it because
Oh, thank you.
trust goes it goes the full extent of the way.
Hmm.
My father just went through something. Well, I could talk about it. It's my personal experience, right? He was diagnosed with lung cancer, and thank God he's okay now. He had it removed. He's on surveillance, but I work for Stony Brook. He was in Stony Brook. He pushed to go to a first second opinion. You go to MSK. That's like the well-known cancer society over here. That's where everybody wants to go. He told me, he said, Nick, I know you want me to go over there. I trust my doctor. And he stayed with his doctor, and the surgery went great. He was playing golf this morning. So that trust, it's a home run answer. So touching me, right at the home points right there. So I think that was great. I really do.
That's
So
good. That's good. That's good to hear that he's fine.
yeah. So I'm gonna transfer like into healthcare leadership, entrepreneurship, a little bit more tailored to those questions. So you've had various leadership roles, including chief medical officer, medical director. What key principles guide your approach to improving health outcomes and promoting best practices in hospital administration?
Wow, that's a really good one too.
I'm bringing the heat now, Dr. Martinez.
I can say that the only thing that comes to my mind is love. I love what I do. I enjoy what I do. I enjoy to help people to find them a solution, and that brings me every time to get innovation. You see, to get there.
Absolutely. I'm now, and not to bring it back to me, but we're just now conversating, I'm 4 years in my role in leadership, and people ask me all the time, how do you do it? It's the passion, it's the love, it's knowing that I'm having the effect on the greater community. And that's why I do what I do. And I think that's the same for you.
Yeah, I love it. I love it. I tell my wife every time that I don't have any retirement plan in my mind.
Yeah.
That I see myself working here for many years.
No, it's fantastic. I'm right there with you. So you've had some, I mean, probably, I don't know, maybe 15 years ago, if I have this correct, but you had experience in emergency departments.
Oh yeah,
Yeah.
yeah. I
So
worked before I got my private practice. I was working for around 5 to 7 years on all the ERs in San Juan. So I was doing night shift, day shift, and I think that what was what built me. I saw a lot of I got strong on my knowledge on medicine because you see everything there. You save life on ER daily, second by second. Okay, but then I try. I tried to look. I was looking for something. I had a family. I have kids. I want to spend time with them, and I know even that I love to have adrenaline. Rushing, working with a lot of adrenaline. I knew that it was time to get something to slow down. I think I don't know what word I can use, but yeah, I did almost. I used to work more than 30 hours per day. I was running, and that is not something that I'm saying that is good. I'm not proud of that, of course. But I have seen a lot of friends that work still working on the ER, and they are doing more than 18 hours. The thing is that I'm going to criticize that you're tired and you're not getting the best answers, from your brain. The brain is tired. So that's something that moved me to a private practice.
no, for sure. But that emergency department experience, definitely, like you said, hands on, learning so much. I think it's so valuable in the healthcare industry. People who don't get exposed to that or only have like some sort of rotation and they go right to private practice. I
Hmm.
had that experience as well, and just like you did, and that I think it shapes the people that we are.
Yeah,
It
because
really does.
I learned what was an urgency and an emergency, and what is not of them. What is something that I can handle the patient, from my office to their home back, without any other intervention.
So now, my question: so, what motivated you to transition into entrepreneurial ventures like New Breeze Home Care LLC and Advanced Wellness Center LLC, and what lessons did you learn from these experiences?
Oh, well, I always have been very. Let me see what is the right word. Um, I cannot stay quiet in one place. So I love to do things,
Yeah,
and I love to invest also. So I did a lot of investments in my life. That New Breeze Home Care was one of them, and it was good. It was a good business. It was sold. And Wellness Center is still working today. It's one of my major strong base of my practice, and I try to bring everything that is new close to me, close to my people, close to my patients, and I learn a lot of stuff. Taking when I talk about wellness. So um, I what I learned that is good for me, and so I can I can still live in more years with quality. I bring it to my clinic of wellness and to my patients. And if they trust you, yeah, they will be part of you.
Yeah, I did. What we spoke a couple weeks ago, and we couldn't meet because you were out on a convention learning in California, something like that. So
I know,
he walks the walk. He may talk to somebody who walks the walk. I can vouch for that one.
I know. It's crazy.
And so now, as an author and a public speaker, I mean, pretty generic question, but what messages do you hope to convey to the broader healthcare community and the general public? What's your message?
Wow. What I have been doing in the past 15 years as when I'm talking about TV, I do news most of the time. What is new on healthcare, or maybe any other issue that's happening around the world. So I try to bring information to my patients without scaring them. That's point. That's one point. As a public speaker, I try to. It has been recently in the past 4 years that has been more active as a public speaker on university or any other places. I have been trying to teach the correct use of AI in healthcare, and I have been. I also include what the ethics of using healthcare, and I try to teach doctors and every other healthcare worker to use their minds and criticize so they can decide which model or algorithm they're going to use in their practice or hospital. They have to ask a lot of questions. So that's what I do. You have to be critic. You have to ask how it was done, who did it, and how was trained. And because in the near future, maybe in the next year, we're going to see people knocking on the doors of every clinic, every hospital, selling something that the buyer doesn't know how it works, and is buying something and applying to human life. So that is a risk, and that's what I teach on public speaking.
I like it. So I guess yeah, this is my final question, right? Because now we're looking ahead. So looking forward, what do you see as the most pressing challenges and opportunities for the healthcare industry? Especially concerning the integration of technology and patient-centered care. And you can integrate that AI right into that too.
Oh yeah, it's AI all
There it
things
is,
that I
right?
say.
Yeah.
Wow, there is a challenge that maybe is in the past right now. There is a lot of challenge in the healthcare, but we have to check for patient safety first. Second, um, we have to try to be fair with all the patients. You cannot. If we are going to use something good, it has to be good for everybody. We're talking about health. We're talking about life. So that's a challenge that I don't know if it's gonna be fixed in the near future. But at least what is coming down with AIs and healthcare, it should be considered. See?
Because, you know, where AI could take things off our hands, I could just correlate it to what I do. We have a call center of 20 people. You have a bot that could replace, I mean, people might not like me saying this if they listen to this, but if you could replace them with AI, that also it's going to free them up now to do more patient facing tasks,
Mm-hmm.
treating patients, helping physicians, getting them changed, bringing them back. This is my world, right, in the radiology aspect. So it frees up humans to show that compassion, show that empathy, instead of, because it speeds up all these other tasks, that, clerical side of it. So that's something that I see, but in my landscape in the radiology, but I'm with you. I think AI is gonna
Mm-hmm.
help that.
Yeah,
It's
and radiology is one of the most impacted, branches of medicine.
mhm.
Positive, man, we are going to see a lot of negative, like you said,
Yep, no,
Uh,
100%. So I greatly honored and appreciate your time. I always like to turn it over just in case you want to tell people where they could find out more information about you, if it's website, if it's LinkedIn, anything you want to say. This is your open mic, so the floor is
sure,
yours,
sure.
Dr. Martinez.
You can find me in LinkedIn as a Doctor Point Orville, Orvil, and something new that I'm working, and I hope to see you here in Puerto Rico. It's
Mhm,
September 25 and 26. We are going to have the first AI and healthcare Congress of the Caribbean and Latin America. It's gonna be a lot of information. I'm trying to bring a lot of unicorns from the U.S. people that is working with their own hands on the AI in healthcare. And yeah, I hope to I will send you more information about it. But
great.
that's something.
All right, you guys heard it. So September 26th, that's
25
the
cents,
weekend.
yeah, of this year.
26th, beautiful. All right, once again, thank you so much for your time, and you have a great night. All right, Dr. Martinez,
Thank you. You too. Okay, take care.
take care.